So there are two main subtypes of systemic sclerosis, and the two subtypes are either limited or diffused. In limited cutaneous systemic sclerosis, the skin involvement is actually less widespread. So as denoted by this purple region, patients will experience skin involvement that extends from the elbow downwards, plus minus from the knees downwards, and their face may be involved as well. In the diffuse subset, the skin involvement is actually more widespread, and patients can experience involvement of the skin that can extend from the elbow upwards, the knees upwards, and involvement of their body as well. So we'll talk a little bit more about the two main subtypes of systemic sclerosis. So the first one, as I've mentioned, the limited systemic sclerosis. The skin involvement, as I mentioned, is less widespread. So if you look at the figure here, the areas which is denoted by the skin color is where the skin involvement typically occurs. So the fingers, I've labeled them bluish here because of Raynaud's that we talked about earlier. They can turn blue or white in response to cold temperatures or during periods of emotional stress. So the fingers, the hands, and the lower arms, legs, the feet and toes, as well as the face are involved in limited subtype. And Raynaud's phenomenon, when it occurs, often precedes the skin involvement by many years. Late symptoms or manifestations that may occur include that of pulmonary arterial hypertension, which is actually due to a condition that results from the increased blood pressure in the artery that actually carries blood from your heart to your lungs. In diffuse systemic sclerosis, skin involvement is more widespread. So again, if you look at the figure here, any part from the fingers all the way up to the elbows and the toes all the way up to the thigh, the body and the face may be involved. And the onset and progression is much faster than the limited subtype. Raynaud's phenomenon often occurs as well, and compared to the limited subtype, it actually occurs much faster, within 1 year of your skin changes. And patients with a diffuse subtype also have a higher risk of hardening of their internal organs, including the lungs, kidneys, as well as the heart.